Like leaders across the nation, El Paso County health officials now looking into phases for release. If the stay-at-home order is lifted on April 26th by Governor Polis, we could see some restrictions modified.
We're currently in phase 1, so what will it take to get to phase 2? News 5's Katie Blaze breaking down what you need to know.
Well, now that we've flattened the curve, according to health officials, we still need to stay the course, but plans are in the works to slowly get back to normal. A big thing to remember, this is only a framework, not a timeline.
We feel, from the public health perspective, that from the first time that this fight started, we are winning and we are in a good place.
Dr. Leon Kelly of El Paso County Public Health says there's still a challenging road ahead when it comes to the coronavirus.
But I think we're in a place now where we can begin to have those conversations about where we go next.
First up, contact tracing, which Kelly says is going to be our #1 weapon to prevent further spread as restrictions are lifted. If a person is found to have COVID-19,
we're going to reach out to that individual, find out who that person came into contact with. We're either going to reach out to each one of those individuals, find out whether they are symptomatic or non-symptomatic.
If symptomatic, they'll get tested and be isolated. For the non-symptomatic, they'll be quarantined for 14 days.
And the way that we're going to do that is by building the capacity of the public health department to have enough folks trained in this so that they continue to do this.
And testing is a big component.
We are working daily to sort out what tests are available and where people can go.
All of this, including social distancing, is part of phase 1. Phase 2 involves reopening certain places. The actions begin a step-by-step return to normal for most activities, but still no large crowds and reduced social distancing.
Most countries that we've seen have done this so far kind of start with their schools, their least at-risk population, which is our young people, opening up some of those critical businesses.
Phase 3, establish protection and then lift all restrictions.
The reality for phase 3 is you need one of a couple things. You either need effective therapeutics, meaning you have drugs, medications that either you can use to prevent the infection
or to treat it. Another option, having a vaccine. All of these things still in clinical trials. When they're made available,
actions are going to be obviously to deploy those medical interventions, which is going to be a worldwide deployment, and we can return to normal social gatherings.
Finally, phase 4. Prepare for the next pandemic.
Predict what's coming, monitor those things, have testing available when they do come out, and be able to generate and engineer vaccines and treatments at a much more rapid pace.
Another project happening right now, a public health data dashboard where people can track coronavirus cases and deaths around the world. We're told this will be launched in the next few days. Always watching out for you, El Paso County. Katie Blaze, News 5.